So are you thinking about having something, done? Safe cosmetic surgery requires homework to assure that your surgeon and facility are up to date. Dr. Ramsey Choucair of Plastic and Reconstructive Surgery is here with some advice for us this morning. Good morning.
Good morning.
To you. All right, a lot of questions for people. A lot of people are a little bit nervous when it comes to making a choice about plastic surgery. So we're going to help calm their fears this morning. Let's start with where you should have a procedure performed.
Well, I think it all starts, of course, with your surgeon who makes suggestions and guides you. But, there are primarily settings where plastic surgery is performed, either in a hospital, which is usually reserved for people who may have other diseases that make their surgery maybe a little risky. And then, for the most part, freestanding ambulatory surgery centers or office facilities.
I see. All right. What about the anesthesia? A lot of people worry about that because that's where we see a lot of problems sometimes.
Right. Well, I think, anesthesia is something that is meant for total patient comfort, and you're guided by what's going to make the patient comfortable for that particular procedure. We have local anesthesia, which everybody would love to have because you can basically drive home yourself almost. Sedation when we need a little bit more to make the patient comfortable, and then general or twilight anesthesia when the procedure is a little more involved to reach a certain patient's goal. And we typically use MD anesthesia, but certainly there are nurse anesthetists who do a fine job. So you have to let your surgeon guide you and feel comfortable.
Okay. Dr. Choucair, what are some of the greatest risks involved in plastic surgery?
Well, I think, again, it's depending on the procedure you're having, and of course the anesthetic is a big part of that risk, and that's why it's so important to do your surgery in an accredited facility that has all the safeguards that you need. And that's why one of the slides we've had previously talks about the 3 or 4 organizations that accredit surgery centers, and you need to make sure you have your surgery in an accredited center.
You make sure that you carefully walk through this process in making a decision as to whether or not it should be a procedure with local anesthesia or something a little bit more deeper.
Correct.
Let's take a look at some of the before and after pictures and tell us what type of anesthesia you used and how quickly we saw these results.
Right. Well, this patient had local anesthesia. She drove to the office. She had a resurfacing of her upper lip to get rid of wrinkles. She drove home, and she was recovering for 4 or 5 days because the wound that you create to set someone back 5 or 10 years requires that.
Okay. All right. Let's take a look at another one then.
This gentleman had his neck lifted and a small augmentation of his chin. He had IV sedation because you can't make someone comfortable and achieve this kind of result without having them a little bit more unconscious, but not totally unconscious. He didn't remember the surgery, but he was recovered in 4 days and back into, the drugstore and the grocery store, etc.
So we should make it clear that he didn't walk out of the office looking like that after picture. It took him about 4 days, and then because this looks amazingly different. He looks years younger. Doesn't look like the same person.
Right. And I think the anesthetic issue is you can only achieve goals in a way that you have the patient comfortable enough to achieve that goal. This patient had a full facelift and a brow lift. This was a general anesthetic. She could have had it under twilight, but she was more comfortable with an anesthesiologist just putting her out. So it depends on the procedure.
So can you accomplish this result with just a local anesthesia?
In my hands and in most surgeons who are trained in plastic surgery, no, because you can't make the patient comfortable enough to achieve what you need to do.
How do you know if your surgeon is board certified?
Well, I mean, there are certainly telephone numbers and organizations that you can go to. The American Board of Plastic Surgery is the organization that certifies plastic surgeons who've done a plastic surgery residency. And I think the next slide we have will show the telephone number and the website to find out. And all of the surgeons who are members of the American Society of Plastic Surgeons have to operate in accredited facilities. So you have some safeguards, and you know that surgeon's been trained.
Do your homework and spend some time talking to that plastic surgeon. Good to see you this morning.
Thank you very much.
You can find out more by calling Dr. Ramsey Choucair at Plastic and Reconstructive Surgery. The phone number is 214-754-9001, or log on to his website at drcplasticsurgery.com.